الخير، شكرا جزيلا على الحضور، شكرا للدعم الدائم للزملاء الصحفيين. المؤتمر الصحفي اليوم عن اليمن، المؤتمر الصحفي يأتي بعد زيارة السيد خيرت كفلاري وهو المدير الإقليمي لليونسف في الشرق الأوسط وشمال أفريقيا إلى اليمن. أحببت أن أعطي بعض التفاصيل عن الزيارة، بعض المعلومات عن الزيارة قبل أن أعطي الكلمة الرئيسية للسيد خيرت كفلاري. وصلنا إلى اليمن يوم 29 أكتوبر، يوم الاثنين الماضي، وعدنا يوم أمس. رافقت خيرت في هذه الزيارة إلى اليمن، وفي اليمن زرنا كل من صنعاء والحديدة. الهدف من الزيارة كان تسليط الضوء على وضع الأطفال في اليمن نتيجة النزاع الدائر والأزمة الاقتصادية التي تواجه البلد. قبل الكلمة الرئيسية نبدأ بفيلم قصير عن الزيارة وعن أطفال اليمن. شكرا. الكلمة الآن للسيد خيرت كفلاري، مدير اليونسف الإقليمي في الشرق الأوسط وشمال أفريقيا. خيرت، الكلمة لك.
Thanks so much, Juliet. صباح الخير. Unfortunately, my Arabic is not as fluent as that of Juliet, so I will speak to you in English. My apologies. I want this moment with you, distinguished colleagues, partners of the media. I want this moment to be a moment in memory of Amal. Amal's emaciated body last week on the cover page of the New York Times shocked the world. Amal unfortunately passed away on the 1st of November, as you all know. Amal, unfortunately, is not the only Yemeni child suffering that fate. Colleagues, friends, 30,000 children in Yemen every single year die with malnutrition as one of the most important underlying causes. So there is not one Amal. There are many thousands of Amal And Juliette and I had the privilege of meeting many of them this week while we traveled through Yemen. We met with Adam, Abdul Rania, Rana. I can tell you, each time I name them, I get very clear, for me, the pictures of them lying in their beds. Some of them attended with, some of them supported by their families. Some of them just lying on their own with hardly anybody to support. Yemen, colleagues, is today a living hell. A living hell not for 50-60% of the children. It is a living hell for every boy and girl in Yemen. And I know figures, in fact, may not say much, but they are important, just as a reminder for all of us to realize how dire the situation has become. There are in Yemen, any given year, 1.8 million children who are suffering from acute malnutrition. 400,000 on any given day. 400,000 are suffering from the life-threatening form of severe acute malnutrition. 40% of these 400,000 are living there today while we are speaking. The war is ravaging. 40% of these children live in Hodeida and neighboring governorates. We were lucky on Wednesday, we are really lucky. Thursday, sorry. We were lucky on Thursday to be able to attend some of these children at Al-Tawra Hospital, the only remaining referral hospital in Hodeida. The Al-Tawra Hospital on Thursday, 1, maximum 2 kilometers away from the front lines. I had hoped Friday morning, before taking the road back to Sana'a, I had hoped to go back. Unfortunately, by Friday, the Al-Tawra hospital had become off limits. Thursday night, while we hardly managed to catch sleep because of the heavy fighting throughout the night. And I can tell you, colleagues, friends, while lying awake, I thought of these children we had seen a few hours before. Rania, for example, half paralyzed as a result of diphtheria. Diphtheria, an illness we can easily prevent if children get in time their vaccines. Rania unfortunately wasn't vaccinated, got diphtheria, half of her body paralyzed. Thought of Rania. Not only was she on her own, not only was she half paralyzed, but in addition to that, as if it wasn't enough yet of suffering, in addition to that, the poor girl will have heard, as we did, the shelling going on, the fighting going on. Just imagine what that girl would have thought. Half of Yemeni children are chronically malnourished. It is a vicious circle. With 1.1 million pregnant and lactating women who are anemic, meaning these women, when giving birth, they know that their child will be of low birth rate, and hence starting that cycle of malnutrition, leading to chronic malnutrition, and all the health consequences for those boys and girls. But not only the health consequences, as we all know, chronic malnutrition has an incredible important impact also upon the child's brain development. So those 50% of Yemeni children who are today chronically malnourished are all, each and every one, they are all children who will never develop their full intellectual potential. And that's bad for these children. That's bad for Yemen, if we ever want Yemen to become a country where it is good living. The vaccination levels, as I mentioned, with diphtheria, the vaccination levels have gone down dramatically since the beginning of the war. And let me also be very clear with all of you. The vaccination levels in Yemen before the war were already not that good. They just went further down. With as a result that for illnesses like measles, diphtheria, there is no countrywide immunity anymore. As a result, indeed, we see outbreaks of measles, we see outbreaks of diphtheria with fatal impact upon children. It should therefore not be a surprise that we once again tell you that in Yemen today, every 10 minutes, a child is dying. Every 10 minutes, a child is dying from diseases that can be easily prevented. Unfortunately, the situation being bad, being incredibly dire, is just further deteriorating. We mentioned already the war, but there is also the economic crisis, with less and less becoming of essential commodities being any longer affordable for the big majority of Yemeni people. I had the opportunity to talk to many families who are benefiting today from a very small amount of money UNICEF is providing through its emergency cash transfer. They are the 1.5 million most vulnerable, most poor families in Yemen. The families receive every month a very small amount of money from UNICEF. These families were telling us that unfortunately, essential commodities are not anymore for them. Buying fresh vegetables or fruits is not anymore for them. And not because fresh fruits and vegetables are not available. You travel through Sanaa, you travel through Hodeida, you travel on the road from Sanaa to Hodeida. Everywhere, fruits and vegetables are there, but they are not any longer affordable. Meat, fish, for the most vulnerable families is no longer an option. So you can easily start understanding why we have these levels of malnutrition. Even drinking water, the commodity that every child requires. If not, children end up having acute and chronic diarrheas. Drinking water for many families no longer affordable. The reason? Well, Yemen is a water-scarce country. Drinking water needs to be pumped out of boreholes. In many parts of the country, boreholes that are up to 1.5 kilometers deep. So we need pumps and we need big water pumps. These big water pumps need fuel. Unfortunately, also fuel becomes incredibly expensive. Hence, drinking water becomes incredibly expensive. Hence, for a growing group of families, not any longer an option. The war continues. There are some positive signs, and I will come back on that. But the war hits hard. I mentioned Hodeida, I mentioned Al-Tawra Hospital and the impact, in fact, the fighting is having upon the local population in Hodeida. However, the problem goes beyond Hodeida. I visited Hodeida Port. Hodeida Port is a lifeline. For 70 to 80% of the Yemeni population. It is a lifeline because it is only through Hodeida port that commercial and humanitarian supplies arrive, enabling us to deliver the assistance in the northern part of the country. Now, with any assault on Hodeida, we do not only fear for the lives of the thousands of children still in Hodeida, but we fear for the impact it will have upon the children population, particularly in the northern part of the country. Should all of this shock us? I hope it does. And I truly hope that the world doesn't need more cover page pictures of children like Amal. Should the situation surprise us? Absolutely not. All of what is happening today in Europe, all the suffering of the millions of children is man-made. If today we are looking at the risk of a potential famine in Yemen, there is no single natural cause for that. It is simply because of reasons for which adults are responsible. but unfortunately with children paying the biggest prices. Do we come back from Yemen despaired? Absolutely not. The children, the families we have talked to, and there are many, do not allow us to despair. They don't allow us. The teachers we spoke to, many of them not having received their salary for several months. The doctors, the nurses in Al-Tawra hospital and other health facilities we visited, again, without any salary, but day in, day out, still doing their best with limited supplies, with limited means, but still trying to do their best to attend to the children. The families, the mothers, the fathers we spoke to, still trying to get the best for their children. They don't allow us to despair. And I'm happy that with the support of very generous donors, we also as UNICEF have reason not to despair. You all will remember that last year Yemen was hit with an unprecedented outbreak of cholera and acute watery diarrhea. Today, thanks to efforts of organizations like UNICEF and our partners, we have been able to reduce the cases of cholera and acute watery diarrhea to 10% of what they were last year. So there is hope. If with the right investment, we can change the situation. But still 10% of people, 10% of what the cases of over 100,000 people suffering from cholera and acute watery diarrhea, that's 100,000 too much. Our investments as UNICEF, together with our partners in fighting malnutrition, is paying off. We have been able to stabilize the levels of acute malnutrition across the country. That's as such, considering the environment, the war, the economic crisis, that is an incredible achievement. It shows again that with the right investment in time, we can change the situation. However, it is not enough, because, as I said, still 400,000 children under the age of 5 are suffering today from severe acute malnutrition. 30,000 children are dying every single year. 30,000 children under the age of 5 are dying every year from illnesses we could have prevented with malnutrition as the main cause. So, while our humanitarian work needs to continue, in the absence of any solution to the economic crisis or in the absence of a peace deal, our humanitarian action need to continue, unabated. Where possible, we need to scale up. Where possible, we need to further invest and improve the quality of that assistance, because it is paying off. Our ask here is for the parties to the conflict to ensure that humanitarian assistance and protection of the people can continue unconditionally. That the many obstacles our teams are facing on a day-to-day basis obstacles imposed by the authorities from both sides. These obstacles need to be removed immediately. Our ask to the international community is to continue to be generous for the Yemeni people, for the Yemeni children. Yemeni people, Yemeni children are trapped in Yemen. There is no way out for Yemeni people. There are very few Yemeni people who have left the country and are living as refugees. They are trapped. So we need to continue to be incredibly generous for the Yemeni people, the Yemeni children. UNICEF definitely will continue doing its share as part of that humanitarian assistance. UNICEF will step up its cash program. UNICEF will step up its assistance to prevent and cure acute malnutrition. UNICEF will start paying incentives in order to allow teachers to have a little bit of compensation for their continued work in the absence of the salary. We are exploring the same for health workers in the absence of their salary. We explore that also for workers who are active in sectors like water and sanitation, for them to continue the critical work with a little bit of an incentive while awaiting the resumption of the salaries to be paid. However, what UNICEF cannot do is to stop the war. But we will not stop on behalf of those 15 million Yemeni children. Call upon all parties to get together later this month under the leadership of the UN Special Envoy, Martin Griffiths. Come together and agree on a ceasefire and a road to peace for Yemen. We call on all the parties when they meet in Sweden later this month, when they sit around the table, just to think of Amal. Just to think of Amal. And think of Amal as their own daughter. Put children at the center of their discussions and not any political, military, economic, financial interest that doesn't serve a single child. However, and that's my last word, while an end to the war is incredibly needed, we should also not fool ourselves, because an end to the war is not enough to stop the suffering for children. It will require a governance of Yemen where indeed the interest of the Yemeni people will be at the center. Yemeni people have unfortunately not had the privilege over the last decades to be governed with their interest at the center. So an end to the war and a governance that puts the interests of Amal and the 15 million children of Yemen at the center. That is for us, that is for the children of Yemen, the only way out. Shukran. Thank you so much.
Thank you very much, Khair. Just to clarify one point, on the half of Yemeni children are chronically malnourished, just to say that these are children under the age of 5 years old. نفتح المجال الآن للأسئلة. يرجى من الجميع تقديم نفسهم قبل السؤال. نادين من الغد، تفضلي.
شكرا. نادين نمري من جريدة الغد. هذا يمكن ثالث أو رابع مؤتمر صحفي بنحضره عن اليمن. كل مرة عم نحكي عن قد ايه الوضع عم بيكون سيء. ألم يحن الأوان إنه المنظمات الأممية ما فيها اليونيسف تواجه الأطراف نفسها بالاسم، بعيداً عن موضوع الدبلوماسية بمناشدة جميع الأطراف. الموضوع الثاني تحدثتم عن ميناء الحديدة وأنه هو المنفذ الوحيد لإيصال المساعدات. لماذا لا تطلبون من الحدود البرية نفس الشيء من الدول المجاورة للحدود البرية؟ السؤال الأخير، تحدثتم أيضا عن أن اليونيسف ستستمر بمساعدة الأطفال اليمنيين. السؤال، ما هو حجم التغطية أو التفاعل الدولي من الدول المانحة؟ هل يتم تقديم المساعدات كما هو مطلوب، أم أن المشكلة في إيصال هل المشكلة في إيصال المساعدات أم في حجمها؟ شكرا.
شكرا نادين.
Thank you so very much. Three very important questions. Your first point of, is it not time to name the parties responsible? Every single party is responsible for what is happening to children today. I would not do justice if I start pointing at one party over the other. Each and every one of the fighting parties today in Yemen are accountable for the suffering of Yemeni children. And I will go even beyond. Every single country that has influence over the fighting parties in Yemen is responsible for the suffering of Yemeni children. So there is not one more responsible than the other. And it's not just those who are today actively fighting in Yemen. It is the responsibility of all parties and each and every country that has influence over these parties. It is not up to us as UNICEF to hold these parties to account. That's not our job. The only thing we as UNICEF can do is that those who have the responsibility to keep parties accountable know perfectly well on a daily basis what the impact of the war is, what the impact of the economic crisis, the man-made economic crisis is upon children. Hodeida board, absolutely, I can assure you that UNICEF is exploring every single day all possible alternative options to Hodeida port. Even in Hodeida, even for Hodeida, we are already using different modalities to get supplies in. in the absence of bringing in big cargo ships. On a daily basis, we bring in supplies if being authorized, even when we are authorized. We bring supplies in small dhows that are traveling from Djibouti to Hodeida or to Salif. We are looking into Oman as an alternative entry point. Aden, of course, as well, should not be excluded. However, any supplies provided through Aden needs to cross the fighting lines. So UNICEF is exploring all possible options. But while we are exploring all possible alternative options and using some of these alternative options already, we shall not stop making the point that the Hodeida port is a lifeline and needs to maintain as a lifeline for 70 to 80% of Yemenis population. We cannot be driven, and the burden cannot become upon us to continuously find alternatives while it is in the hands of the fighting parties to decide that the lifeline shall be respected. So let that be very clear. We can continue looking for alternatives, and we do so, and we use these alternatives. But the accountability parties and those with influence is to keep a lifeline open. So that's why the emphasis remains on Hodeida. And your last question, again, a very important one. Two answers to that. First, are we able today, with the means we have available, to attend to every single child? No, we are not. So more money is still required today. More means are required for us to be able to attend each and every of the suffering children. However, money alone in the context of Yemen is not going to help guaranteeing that we are going to reach each and every child. We can have all the money of the world if parties to the conflict, if those countries with influence make or continue putting obstacles of, one, bringing additional staff into the country to complement or heroic Yemeni staff. We continue struggling with the issuance of visas in North and South. Once we have people in, usually people are in for a couple of months because that's what their visa allows. And we need to go through a new renewal process. And again, with the risk that visa will not be granted. Supplies. Each and every time we want to get life-saving supplies into the country, let me just use the example of vaccines. Have no political or military interest. We are just there to vaccinate children. The sheer amount of time and energy we are putting for having a flight clear of getting vaccines into the country, you don't want to know. And that's only to get the vaccines into the airports. The struggle we are having to get then the vaccines up to each and every individual child is a nightmare. So we constantly face obstacles that prevent us from delivering timely assistance, that prevent us from delivering assistance at scale, prevent us from delivering at any moment of time top quality assistance. So that's why the request is to all those who have influence to make humanitarian assistance unconditional. I met with all parties in Sana'a, and I'm going to Aden in a couple of weeks' time. I've told them, we as UNICEF, we don't have a political agenda, we don't have a military agenda, we are here to help your millions of children. Why, what is it that you can explain that you make our work at times so difficult? Is it security? Are children a security threat? Are children a political threat? Are they a military threat? Nobody in Sana'a had an answer. And I'm sure that in Aden, nobody has an answer either, nor in any of the capitals of countries who have accountability of what is happening in Yemen today. Sorry for being long, but I wanted to clarify. Thanks, Shukran.
Thank you, Geert. Other questions? Jane, yes, please. Please introduce yourself, Jane.
Thanks. Is there a microphone? Thank you so much. I'm Jane Arath from National Public Radio in the U.S. I'm wondering if you could tell us more about the situation in Hodeida port. How much is getting through? Is there still considered to be a blockade? And when you were mentioning UNICEF stepping up assistance, cash assistance, and other forms of assistance, can you give us details on that? How much, if you know, and when that will start? Thank you.
Thanks, Jean.
Thanks, Jim. When we were in Hodeida port, that was Friday. Thursday. There is very little activity while we were there. I was in Yemen, served as UNICEF representative from 2009 2012, and I do remember Hodeida as an incredibly active port at that moment. I was shocked to see hardly any activity going on. The reason for that is there an active blockade? I don't think there is today an active blockade. But it is a political game, as it were. You know, yes, you can bring in supplies, but you know, condition X, Y, or Z. The government in the south, the internationally recognized government, has now requested for commercial supplies to come in, letters of credit to be agreed with the central bank in Aden, which complicates commercial imports. Then UNICEF has supplies coming in. The process of clearance of supplies is, as I said before, is an incredibly complicated one. We found in Hodeida port, as an example, we found we had a Darwin from Djibouti 2 weeks ago with medical supplies. A few hours before, I was in El Taura hospital, hearing the hospital staff saying, these are the medical supplies that we need. 2-3 hours later, I find myself in Hodeida port, finding the UNICEF supplies that have been there for 2 weeks, waiting clearance. And what are these supplies? Exactly the supplies that the people in Al Taura hospital were asking. I called immediately the Minister of Health in Sana'a, who, to his credit, came immediately to Hodeida and got the supplies cleared within a couple of hours. Now, it doesn't require the UNICEF regional director to go to Hodeida for supplies to come in, isn't it? So that needs to stop. The culture needs to be every supply that comes in that is serving the interest of children should have no hurdles whatsoever. So that's on Hodeida. Increasing assistance for us, the cash assistance in particular. So we have been guaranteeing the cash cash assistance to the 1.5 million most vulnerable Yemeni families. That was a cash assistance program that had existed pre-war, that collapsed, and UNICEF, with the support of the World Bank, has started up again. It is very clear that more people need to be reached than the 1.5 million families. It is clear that the amount of money needs to be increased, because what we currently are providing is truly very small, but makes a world of a difference for the families already. So we are currently discussing with the World Bank and other generous donors to get the amount of money available for the cash transfer to increase, so that we can continue with the payment and reach even more people and provide even more cash as possible. We are starting, hopefully beginning of December, the incentive program for the teachers, a program that will reach the 135,000 teachers who have not been paid a salary for 2 years. So this is a program that will provide every teacher on a monthly basis $50 as an incentive, while we are advocating with the authorities on all sides to have the resumption of the salaries of civil servants happening. So that is guaranteed, so we will start on that beginning of December. We have been advocating and continue advocating in order to set up a similar scheme for health workers, doctors, nurses, health workers in general, for water engineers and sanitation engineers, so that essential facilities can continue functioning and that the people get an incentive for that. And each and every time targeting those people who have not received their salaries for the next 2 years. So the teachers, we can say today, we are able to implement from December onwards. For the other civil servants, we are still negotiating with donors to get the money in order to have those civil servants paid. Thanks.
Thanks, Geert. Other questions? Okay, thank you very much for coming today. شكرا جزيلا على الحضور. في الخارج مواد يعني دعم القصص المكتوبة، وأيضا هناك رابط إلى مالتي ميديا، مواد صحفية مرئية مسموعة تتواجد مع زميلنا الكريم. شكرا جزيلا، شكرا مرة أخرى.
Hello, sir.